You know, what made me attracted to periodontics and really feel like it was what I wanted to do and focus on as a specialty was different than a lot of other dental specialties. It allowed me to use my science background and also the surgical aspects, that we can regenerate bone, we can regenerate gum, we can change a patient that may not have enough of those two structures and actually rebuild it, which is different than a lot of other specialties. It also allows me to repair teeth and regenerate bone around teeth to make the teeth stronger, or gum around the teeth to make them stronger. And so it's the regenerative aspects. We're actually regenerating lost or tissue that patients don't have. So oftentimes we take our teeth for granted. That's a big one. You know, I think we all take our teeth for granted. But in order for the tooth to be healthy, you know, it has to have healthy bone around it, it has to have a healthy root around it, it has to have healthy gum around it. Same as a dental implant. For a dental implant to be healthy, it needs to have healthy bone around it, it has to have healthy gum around it. And that's again why once we lose the tooth, that's when we kind of start thinking, oh, how do I get it back? How do I get that health back? My tooth is loose, or I'm missing a tooth. How do I get that back? And once we start losing that function, losing our health, our dental health, that's when we kind of patients will start kind of seeing us to help rebuild that. In its basic form, a dental implant is a new healthy root, titanium root. It's a mechanical root that allows the dentist to then add a tooth to it, which would be in function so the patient can chew. So again, we think that a dental implant is a tooth, but actually the dental implant is the healthy root, right? And that's why, again, you might see the periodontist, because that healthy root needs the same as your natural healthy root. It needs healthy bone around it, needs healthy gum around it, right? And then once you have that health, that good stable function and good foundation, if you will, once you have that healthy foundation, then you can put teeth on there, or you can put a crown on the tooth once the tooth is healthy, if the tooth is healthy enough. Over the past 20 years, you've had a lot of improvements with regards to technology that has made us better at doing dental implants. Dental implants themselves, the technology that allows the titanium to bond to bone, hasn't really changed much. The healing of the bone to the implant really hasn't changed significantly over the past 50 years. However, the things that have changed is our diagnostic skill, our diagnostic technology, our equipment that allows us to make sure patients have an adequate amount of bone, cone beam scanners, CAT scans, or cone beam CTs, that's what I would say, which is a special low-dose radiation X-ray machine, three-dimensional X-ray machine that allows us to see the bone in 3 dimensions. Then we have CAD/CAM software that goes on top of that allows us to simulate implant therapy placement. And then also, we also have navigated implant drills, which allows us, after we've done all that planning, to allow us to make sure that we put the implant in the most accurate location and place. That precision, the navigation systems, the cone beam CTs, that precision allows us to determine whether or not we need bone grafting beforehand, one, or it allows us also to be more accurate with the drill placement. When we're doing drills, sometimes just by hand, or without a guide or without navigation, our drills are sometimes actually wobbling more than we might think. We might think they're going in straight, but there's actually a lot of wobble. And that wobble creates a larger diameter hole or osteotomy, right? So the implant itself then goes into a less accurate location. If you use a navigation system or guide, and the navigation system is even more accurate than a normal template or guide, then what happens is that the implant goes in much more solid, it has better stability, and oftentimes be exposed and allow you to avoid second stage procedures and other procedures and go at a lower cost.